We recognize that we have attained an endemic new norm, and we are ready to redefine our community protocols for COVID-19 infection. From Monday, the 13th of February, we will stand down protocols 1, 2, 3. Henceforth, if you test positive for COVID-19 infection but are asymptomatic or minimally symptomatic, please exercise social responsibility and minimize your social interactions. You should avoid crowded places, and in particular, please avoid coming into contact with vulnerable persons who themselves are at increased risk for developing severe COVID-19 infection. This includes avoiding visiting your loved ones in hospital or in nursing homes until you have recovered. You should also wear a mask when coming into contact with others who might get otherwise infected from you. If you are infected but have mild respiratory symptoms, please stay at home until your symptoms resolve. But if you have a more severe infection with prolonged or worsening respiratory symptoms, or are medically vulnerable to getting a severe infection, please see a doctor who can assess you properly and decide whether you need to be referred to a hospital or community treatment facility for more monitoring. The doctor will also assess whether you will benefit from a course of oral antiviral medications. Given the low numbers of patients with severe COVID-19 infection in our hospitals, we no longer require our acute hospitals to set aside dedicated isolation ward or ICU beds just to treat COVID-19 infected patients. This means that patients with COVID-19 infection will be treated based on the severity of their presenting medical condition with an appropriate infection control set of precautions implemented, similar to any other patient who comes into the hospital with non-COVID-19 related respiratory infections. And when their acute medical illness is brought under control and there's no longer any need for further acute care in our hospitals, these patients may be discharged early to further recover at home, irrespective of whether they have fully recovered from their COVID-19 infection. We believe our refreshed clinical policies reflect a sustainable approach to dealing with COVID-19 in a new endemic phase, without compromising on clinical outcomes for our patients. Being in this endemic phase does not mean we will no longer see any more COVID-19 cases or cluster of cases in the community. As new variants of concern emerge in the future, which are more transmissible or virulent, we may see more waves of infection rising from time to time. However, as long as our robust hybrid immunity remains high, we are more resilient to such waves of infection and are less likely to see our healthcare system capacity being overwhelmed. We will continue to monitor closely our healthcare capacity and work to strengthen our resilience against COVID-19, taking in the lessons gained in managing COVID-19 in our hospitals, in our community facilities, nursing homes, and in the community. And if there are signs that a new and potentially more dangerous variant emerges in the future, or if our healthcare capacity becomes strained, we may have to revise our posture against COVID-19. And this may mean reactivating some of our community and border measures at short notice. There may even be a need for our population to urgently receive booster vaccinations to ensure we remain adequately protected against severe COVID-19 infection. And should this be necessary, I seek the support of everyone in Singapore to rally together against COVID-19 as we have over the past 3 years. We could not have reached where we are today without the support and strong partnership of many. And this includes healthcare workers from different backgrounds working in our PHPC clinics, in dedicated community treatment or isolation facilities, in nursing homes, and in both our public and private hospitals. And I'm grateful for the sacrifices made by all of them and deeply appreciative of their service. Thank you.